As you can see, here is a standard EKG machine with a EKG or ECG printout. It's got 12 leads in a format that's standard. As you would see it on a patient, the electrodes placed on the patient's skin. Of course, how it would look kind of superimposed there. Very hard concept for students to gain when it comes to how does this paper relate to the heart inside the body. And that's where HoloLens is going to come into play. So HoloLens with Holo Anatomy, as you can see here, the left picture here, it shows the electrical conduction system of the heart, and how it starts with the SA node, and it fires down to the AV junction and the Purkinje fibers. So in this model here, you can see how the heart sits, and the conduction goes from the right atrium down to the ventricles, the left ventricle itself. The heart has to pump from the heart to the system, the pulmonic system, and then the systemic circulation. So the heart has to get the oxygenated blood to the rest of the system. And as you can see, it's a large system, a lot of tubes, the arteries and the veins, and it's a system that functions. The heart beats contracts because of the cardiac system, the electrical cardiac system. And so that's what this is going to do. How does all this help us understand what's going on with the human body? So as you can see here, we have lead placements here. You can see right arm, left leg, right leg, and then the precordial leads V1 through V6, as you can see here. There is a standard of placing this on a patient. Here's a cadaver that shows the dissected specimen up to the thoracic cage or the cavity. This is how you would look at that through the holoanatomy. The cool thing about this is that we can actually see inside and see what's below these particular placements. So we have V1, V2, V3, V4, V5, and V6. And you can see V6 will look at the heart this way. So we're looking at the left lateral aspect of the left ventricle. Where V1 electrode, small e's for electrode, so we're not confused with the other diagram. And the right arm will essentially, Einthoven's triangle kind of dictates what we look at as far as electrical activity. So here, once again, placement again. We are looking at the skeletal system and how the lead placement has to be placed at a certain area so the bones do not interfere with the reading of that particular lead or region. You can see here how the cadavers opened up to the heart and the pericardium. And you can see the heart is lying there, and it would be in this region. And so you can kind of imagine how these electrodes picture this heart, the electricity of the heart. So once again, now this particular model and the labels here are looking at the regions of the heart, the leads of the heart, instead of the actual electrodes. If we go back, These are the electrodes, the placement of the stickers and the wires, as you can see here, on the person. That relates to the regions that we're looking at, or the leads that we're looking at. And so, as you can see here, the lead placement and then the lead itself, which is very, if you look at this particular EKG, you can kind of see, okay, that's what that means. The color is showing the regions of the heart that are being looked at through the EKG or the ECG. And so that's what this is going to do. So how does that look here? As you can see, the regions are viewed, and you can kind of see, you'll start seeing the dots in there of the heart. You can see the heart right there, the left aspect of the heart. You see green, you see some red dots, some yellow dots, some blue dots. Those coincide with the colors on there. So let's take a deeper look at this. And so you can see now we're just looking at the axial system of the skeletal system. So we can kind of see how the heart sits in there, how the vena cava interacts with the heart, and the aorta here, the aortic arch, interacts with the heart. So now you can actually see that in here, our lead one here, let's look at lead one. So lead one is going to be over in this region. Looks like the label's off, but that's okay. We know that it's looking this way. I'm sorry. Yeah, looking that way. So we have lead 2 looking at the bottom here. You can see the green there. AVF is also looking at the bottom, and lead 3. So you can see these particular leads on the EKG itself, the printout itself. Then you have, here's lead 1, I'm sorry. So lead 1, you have V5, V6, and AVL looking at that particular region of the heart. And as you can see, lead 1, AVL, V5, and V6 are looking at that. And that is what we're looking at here. V1 and V2, if you kind of look in there, you can see that it views the septum of the heart, the ventricular septum. And you can see the septum here and how those particular views are looking at both sides of the septum. And so that's the septal region here. Okay, that's how it's laid out in the EKG printout. We can look here that V3 and V4 are looking at the anterior aspect of the left ventricle. So this is the left ventricle. And so we're looking at the anterior aspect of the left ventricle, which is telling us that on this particular printout. And once again, we do have the inferior aspect here. It's in the green. Lead 2, AVF, and lead 3. And you can see that there. And once again, the lateral aspect of the heart. So, and this is how it would look in a normal breathing person. This is an X-ray, an actual X-ray of the cardiac or the heart, the cardiovascular system, and how it situates itself, or how it sits in the chest cavity itself. So what does all this mean? So we took the bones away. So now we're looking at all our leads here, okay, and how it looks at the heart, how it views the heart. And you can see that there are some particular vessels here, the left coronary artery, the main artery, and then you have the circumflex, and we'll kind of get into that. This is what this is, this diagram here. And so you can see that you have your left coronary artery, you have your left anterior descending, your circumflex, and then your left marginal. This is, once again, as we saw earlier, and we can actually see now, look at the difference in the muscle of the left ventricle here and the right ventricle here. Okay, much thicker on the left. It needs more supply. And if you can see the atria up here, not as thick either. Okay, very low pressure in that. High pressure occurs in the left ventricle, the highest pressure, because it has to go throughout the system. And so these are pretty important for these to know, for us to know whether they're blocked or not. And that's what an ECG tells us. And so it tells us, okay, look, V1, V2, you can see that as you can see here, the left anterior descending comes across there, the circumflex, and then for most of the population, that'll supply the inferior aspect of the heart, of the left ventricle. In some cases, the right coronary artery, which branches off of right there, will actually supply the inferior aspect of the left ventricle. And so, kind of taking more away, you can kind of appreciate, you can really appreciate how the leads view the heart and how it sits. Took away all the muscle of the heart, so we can actually look at just the coronary arteries. And you can see how, once again, the left ventricle is the powerhouse of the heart, and it supplies the blood to the rest of the system, to the body. We need to know whether or not this is functioning. And because it's a larger amount of tissue, larger amount of muscle, it creates the greatest amount of electricity. And that's what you're going to see on a cardiac monitor. So here's the labeled coronary arteries: the left marginal artery, the right posterior descending artery, the left circumflex, the left coronary artery, left anterior descending, your right marginal artery, and your right coronary artery. As you can see, the left side is much more robust because it's taking care of a lot more muscle. Kind of putting it all together, you can see how the heart sits. We can kind of look at, once again, we can see the difference in the thickness of the wall of the left ventricle and why it's pretty important and why it does create that particular rhythm. So you can see here, this is an actual EKG or an ECG. EKG is electrocardiogram with a K, which is kind of nods to its past. It's German cardiogram version, EKG. ECG is electrocardiogram, which is more proper English use of the C and a K. So you can see here you have your lead 1, lead 2, lead 3, your AVR, AVL, AVF, V1, V2, V3, V4, V5, V6. And this bottom one is our monitoring lead. Most monitoring leads are placed on lead 2. It gives us the view of the heart of the majority of that left ventricle. So it kind of gives us an overall picture of how the heart is doing. This one here, we kind of flipped here. So this one shows it's something pretty interesting here. So you can see lead 1, lead 2, lead 3, AVR, AVL, AVF, V1, V2, V3, V4, V5, V6, and then our monitoring lead. So you can see here that lead 2 is showing you have a PQRST, PEQRST. I think we showed that at the beginning. But that ST segment is what's elevated. And you have another elevation in lead 3 for the ST segment. You have a depression here in AVL. And then you have another ST elevation. ST elevation, myocardial infarction, STEMI is what we're looking for. And so now we're looking at V1, V2. You see some depression there, some major depression, as well as in V3, V4, and then you have some slight elevation in V5 and V6. So looking at this, we have elevation in the inferior aspects, we have elevation in the lateral aspect. And so this is going to likely be an inferior lateral MI. And that's how we kind of put it all together. Thank you very much for your watching. Have a great night. Stop video.